When we have degenerative disc disease, or as we reach the age of approximately 40, our discs become a little bit weakened. There are two parts of the disc. There is the nucleus, which is the inside, and this is what the spine uses to absorb any shock. And then there's the outside of the disc that is full of collagen. There are collagen fibers that is wrapped around the nucleus. And those collagen fibers have a tendency to separate, or they become weakened as we get older. Or any traumatic event can cause these collagen fibers to tear. The disc can tear even without a traumatic event, or they can open up and they can fissure. But tears I see in my practice are frequently associated with traumatic injuries. It doesn't matter if you were involved in a motor vehicle accident or if you were lifting a heavy object such as a heavy box. This can cause a tear of the disc. And when that tear occurs, the nucleus sometimes seeps out and can cause a disc herniation.